this is Melissa Fuller with Shape of the City. I am here with Dr. Bob Browner with Partnership for Healthy Lincoln. Partnership for Healthy Lincoln has worked with Lincoln Public Schools over the years, and they have worked to evaluate the relationship of fitness and physical activity as it relates to academic performance. Partnership for Healthy Lincoln also has worked with a project called Place Matters, a mapping project that looks at where you live as a relationship to your health. Can you talk to us a little bit about that project? What are the outcomes? What are the impacts that you are seeing, and how are the different ways that you can look at these maps?
Yeah. Well, mapping is kind of a new technique to find out. We've got lots and lots of community data, but people really haven't in the past looked so much about where it's getting better or worse, looking at just overlaying on a map of the community. And so a lot of sources of data now are becoming available where you can do this, whether it's crime rates, access to prenatal care, but even school data like physical fitness, for example. And so the Community Health Mapping Project took data from all these different sources, created them on overlays of maps, mostly using census tracts to say, okay, where are things better or worse in town? And then hopefully the next, what will we do about it? Probably the most common theme is that most of these factors tie back to socioeconomics. So the relative wealth of the neighborhood has effects on everything from access to prenatal care, aerobic fitness of the kids, longevity, even academic achievement in schools. And so, great, now we know this information, now what are we going to do about it? I think that's the next step.
What are some of the things that you as Partnership for Healthy Lincoln will be looking at specifically?
We started looking more at weight and aerobic fitness because it had those were our two main things we could measure with the health of children. And so it's kind of some have grown over that in the next 10 years. In the last few years, we've been working with the Community Health Endowment to add that to the mapping project. A lot of these health things start out at a very young age, and so the younger they start, the better. So if you're going to talk about longevity when you're 70 and 80, some of those habits start when you're 5 and 10 and 20, and so we really, if we want to make a long-term impact on the community, we need to start young. And even some of the things like I really am excited that they added access to prenatal care, because even those things are dramatically different from one census tract to the next.
So what can you also learn from some of the anomalies?
Okay. Well, sometimes things buck the trend, and then that's where I think where the most interesting ideas come from. There's a couple techniques that are used worldwide. One of the best examples is something called the Camden Coalition. It was a family doctor named Jeff Brenner in Camden, New Jersey. Started mapping things like admissions to hospitals and emergency rooms rates and finding out that they were coming from small pockets in the neighborhood. And so one thing they did is they started sending out community health workers to those pockets of the neighborhoods, and lo and behold, they made a huge difference in how many people were landing in the hospital emergency room by dealing with things in the neighborhood sooner in a more targeted fashion. And I think that's where you're going to start seeing a lot of things opening up. Our data right now is only census tract level, which is too big. We need to cone it down and figure out where can we best put the resources that are needed. Another example is that, for example, academic achievement and fitness are very correlated with the socioeconomics of a school. But there are some schools that buck that trend, actually. And so for aerobic fitness, for example, Park Middle School, despite having a very low-income population, actually its fitness rate's not that far off of some of the wealthiest places in the neighborhood and in the other neighborhoods. So what could you learn from that? What's going right at Park Middle School that could be reproduced at other middle schools? Another example in academic achievement, you see very tight correlations again, but one school really bucks the trend, and that's Belmont Elementary School. So what's going right at Belmont Elementary School? And are there any things that are happening there that we could transfer to all the other lower income elementary schools and get similar improvements? And what they find is that everybody wants the one solution, like if I just put an EduCare everywhere, will that fix everything? Well, EduCare is probably part of why Belmont's doing better, but it's probably not all of why Belmont's doing better. It may have something to do with the community learning center, the leadership of the principal, the mentality of the teachers, the cohesiveness of the neighborhood or the park. I mean, there's a lot of things that go into that. And so I think one of the more interesting things now will be look at frankly, the people who just don't fit what you'd predict. Why are there surprises in a good way, and what's reproducible that we could do someplace else?
So what's next?
Okay. Well, I think next is trying to figure that out. So, for example, when I was looking at the fitness data, talking about it with Matt Avey, who's the head of Health and P curriculum at Lincoln Public Schools, pointing out park, he's like, yeah, I think I know what's going on. So he is talking with the park principal and the P teachers there saying, okay, what are you doing different that maybe, Kohler or Loeffler or some other places could do? From the academic achievement side, I know Lincoln Public Schools know that Belmont overperforms for a while. But what other things are there? What's going on? What could they do that could be transferred someplace else? And if it's broader than just the school, it may be a neighborhood level solution or a community learning center level solution. So it may be more than just what the school can take on by themselves. And I think sometimes in the past, for academic achievement specifically, people want to blame it all on the school or blame it all in the neighborhood. And honestly, it's a combination of those, and it's going to be a broader solution. So we have to get people from off of that one solution mentality, quick fix mentality. But we know the data shows that it can be fixed at least. So don't have a defeatist attitude. There is ways to make this better.
So I know the maps are accessible on the Community Health Endowment's website. I think it's chelincoln.org. Are there any other last messages you'd want to leave with our viewers?
Okay, well, I think just learning more about it. They've got, the Place Matters maps. They've got a brochure. It's on the website. There's presentations. I know Lori Seibel's been giving them to a lot of community groups. I think it's a great conversation starter tool about what can be made better. Learning more about the neighborhood and the makeups of Lincoln, I think it's a very helpful thing to start seeing this. It's a better way to look at data. Just seeing, columns of numbers isn't as helpful, but when you turn into visuals where people can see the differences, I think it's much more helpful. So I think first is having people get more educated on it, and then second, okay, now what are we going to do about it? How do we marshal the resources, the funding, the things like that to fix these problems?
Perfect. Thank you.